We are going to look for 1.1 million people who are known to be HIV positive, but are not on treatment. Either they've stopped or they've never even started treatment. We are doing so because we want South Africans not to get used to the idea that there's a disease called HIV and AIDS, and it's there, and we are going to live with it, or we are going to live side by side with it. We don't want that, because that should not be, excuse me. They must know that we must eliminate it. We might not eradicate it, but our aim is to eliminate it as a public health threat by 2030. And the system we are going to use has been defined by UNAIDS, called 95-95-95. That 95% of the people must know their status. And those who are positive, 95% of them must be on treatment. And those who are on treatment, 95% of them must be virally suppressed, meaning they must not have a capacity to transmit the virus to the next person, even when they remain positive. Once you reach that stage where 95% of the people are virally suppressed, then the virus is not being transmitted. Then we are okay, because at the moment, we are still getting 150,000 new infections every year, which means the virus is still being transmitted. But only that, unlike some 12 years back, 15 years back in 2010, people sort of are no longer scared, because they say, no, HIV/AIDS can be under control. You can take treatment and live a normal life. We know that is so, but we don't think we should accept that you must live with this disease. It must go. And that's why we are looking for those people in order to reach our 95-95-95.
What are some of the techniques and tools and outreach programs that will be done to reach that 1.1 million people?
There will be many. First of all, we took the 1.1 million people and divide them province by province. Because when you look at the figure of 1.1, it's scary. It's quite big. But when you divide it province by province, you start realizing, I know that Eastern Cape, for instance, need to look for only 140,000 people. So it's no longer scary when you do it that way. Then within Eastern Cape, there are 7 districts. When you go to divide it into those districts, it's much, much less. Then you divide it into health facilities. You may find that one hospital or clinic only have to look for 3 people. And that's very manageable. Only have to look for 3 people who are taking treatment.